We're pleased to be joined by Michellene Davis, who is the Executive Vice President and Chief Corporate Affairs Officer at RWJBarnabas Health. Good to see you.
Good to see you.
Let me disclose that you are a trustee of the Caucus Educational Corporation, and your organization is a significant supporter of public broadcasting.
Indeed.
So many times you've been with us in the past, we've talked about a whole range of issues, particularly affecting people who are economically challenged, people of color, a whole range of issues, socioeconomic issues tied to health care. ALICE stands for?
Asset limited, income constrained, employed.
What is and why should we all care deeply about this, Michellene?
Because Alice's experience really does impact us all. So the reason why the United Way came up with ALICE as the moniker, most individuals refer to this population of vulnerable citizens as the working poor, is because we wanted to make certain that they had a clear picture of the fact that Alice is everywhere. She pours your coffee in the morning, she serves your breakfast, she takes your toll as you're on your way here. Alice is all around us, and it is time that we see her.
What price do we pay if we don't pay enough attention to the needs of Alice? How does it affect the rest of us who don't fall into that category because we're fortunate?
Well, so I will utilize the example of healthcare. If, in fact, we are not giving a good opportunity to ensuring that Alice is somewhere in one job, literally making a livable wage, rather than in 2 or 3 roles where, quite frankly, she has no coverage and without proper benefits, then what happens is the fact that between her first, second, and third job, she puts off that doctor's appointment, right? She puts off that preventable care visit. As a result, by the time Alice finally has to make the time in her schedule in order to come and see us, she is already at stage 4 of this chronic disease. So she comes in through our most expensive door, through our emergency room. And she's already presenting at such a chronic place, such an incredibly bad stage of her disease, that all we can do is literally provide the most expensive care, right, in order to manage this emergency issue, which, Steve, could have all been prevented had we, in fact, been certain that Alice had an equitable opportunity to make certain that she could build some community wealth and literally manage the demands on her life.
You know, it's so fascinating to me, Michellene. I've moderated a fair number of healthcare forums, including within your organization, and one of the issues that keeps coming up is the social determinants of health. First of all, what are they, and are they connected to Alice?
Oh, absolutely. So
what are they?
So, Steve, the social determinants of health are literally those things that occur outside of a clinical setting. So I like to say that it is really the aspect of what makes up your life, right? So it is where you live, whether or not you have access to healthy, affordable, good fruit and produce.
Transportation?
Oh, transportation is undoubtedly
big deal.
A social determinant of health. Absolutely. Individuals so often neglect to recall the fact that everyone in the Great Garden State does not have a vehicle. And despite the fact that our railways and our byways really give us a great opportunity to get into and out of the state, traversing through is still pretty difficult. And so the truth of the matter is that the social determinants of health really deal with everything outside of that, right? Do you, in fact, live in safe and secure, affordable housing, right? Or are you spending upwards of, as we do in the state of New Jersey, between 50 and 70% of an income, when really the national average is around 35%? Are you, in fact, spending too much of what should be disposable income on literally just having a place to habitate?
And in terms of the impact on health is?
Well, what we know is that a housing-first model works, right? So evidence shows us that housing is a real indicator of health outcome, but so is having a livable wage. It is an incredibly important aspect of ensuring that we are literally pushing back the tide of healthcare disparities and actually arriving at a firm location.
How do you push back on that?
Oh, my goodness. You do it by making certain that I am not just treating the disease that you present with when you come into my office and hop up on the table.
Isn't that what fee-for-service is?
That is.
You come in, you got this, we deal with it as best we can.
Absolutely.
And you pay the bill, or
Absolutely.
some combination of government, health insurance companies.
Absolutely.
Well, then how's this different?
Well, because
it just sounds like a different model.
But the industry is traveling towards a different model, right? We are headed towards value-based care. We are headed in that direction anyway. And so what RWJBarnabas has decided to do, and our incredible visionary of a CEO, Barry Ostrowski, is to ensure that we not wait for the rest of the world to catch up. Rather, we want to make certain that we are making a firm, declarative commitment to utilizing our anchor mission, which is really our place-based presence in any of the locations where we are facilitated, in order to ensure that we are bringing about the tide that is supposed to be lifting all ships. But what we have found is that historically they haven't, and they won't without intentionality about ensuring that we are attaching to the most vulnerable, to the Alice's, both inside and outside of our walls.
You know, it's interesting, different terms are used, and social impact is a word that comes up a lot.
Yeah.
Actually, at our the Dr. Martin Luther King annual award that our Stand and Deliver program bestows on different organizations and individuals that make an impact. That team, that social impact team, was recognized. And in the spirit of Dr. King, be the change, if you will. Here's my question. What is social, you get a lot of the phrases here. Social impact, social determinants of health. Help us navigate that.
Yeah.
Social impact, in what way?
So the way in which we literally seek to implore social impact is to ensure that we are, again, taking a look at, right, so what are the systems and structures that have brought about the inequity that we currently see? And what do we need to, inequity, meaning that, so things are not just unequal, they are literally inequitable, right? So lots of folks believe that the answer to something that is lacking inequality is literally to merely level the playing field. But that is not enough, Steve. It is not enough.
Because?
It is not enough when we take a look at the data around, quite frankly, the disparities which continue to exist. So as the health outcomes of the general population have gotten better, the health outcomes of particular segments of vulnerable populations has actually gotten worse. So we've widened the gap in reference to everyone's ability to literally grow up to be healthy and strong, right? That's not what we want.
Well, excuse me, sorry for interrupting. It starts right from the beginning. Our series, right from the start, NJ, looks at 0 to 3 infants and toddlers, childcare. Is it not a fact that black mothers are more likely to lose a child in childbirth than white mothers?
It is a fact, but even more than that, it is also a fact that in the state of New Jersey, African-American women are 5 times as likely as our white counterparts to literally, unfortunately, lose their life. Well, listen, I saw you cringe just now. In New York, it is 12 times as much as our white counterparts. Now, this is what I want to make certain that people do not walk away from this opportunity believing that in some way that these women have decided, oh, I know what I'll do today, I'll die today. That is not what happens.
What is that?
Rather, it is a combination of both, yes, indeed, the social determinants of health, meaning where we live. So as you know, here's the issue, Steve. Redlining has been real in this state and the rest of this country, right? The lines on those maps were really red.
Redlining, go Google redlining. There's a history in our country.
Here. So as a result, what we know is that wherever there is, quite frankly, poverty in greatest concentration, we tend to see these bad health outcomes. But as you know, redlining meant that no matter how much I could afford, I was only
You're not living in that neighborhood.
You got it. To live within a certain
Keep you
footprint.
out.
And what else was in that traditional footprint were also the environmental pollutants that everyone else around in more suburban areas had said, NIMBY, not in my backyard.
Not in my backyard.
You got it.
But so then who got left behind? By the way, a few seconds left. Who got left behind?
So traditionally, the most vulnerable, right? The Alice's of the population. It's important to note as well that Alice literally means that they may be above the federal poverty level, right? Which means that she cannot attach to any government subsidy. And unfortunately, she is still having difficulty making ends meet.
A lot for us to think about. And a few seconds left. I just want to say this. I'm not going to editorialize, but it seems to me that when people say things like, I'm good, my family's good, we have insurance, that's not my problem, it's everyone's problem. It's everyone's responsibility. And by the way, if that's editorial on public broadcasting, I'm sorry, but it is what it is. This is Michellene Davis, Executive Vice President, Chief Corporate Affairs Officer, RWJBarnabas Health. Thank you, Michellene, for joining us. We appreciate it.
Thank you so much.
Well done. This is State of Affairs. We're coming to you from the Agnes Varus NJTV studio. Let's continue the conversation on Twitter, at Steve Adubato. You get all the rest. We'll see you next time.
State of Affairs with Steve Adubato is a production of the Caucus Educational Corporation. celebrating over 30 years of broadcast excellence.
Funding for this edition of State of Affairs with Steve Adubato has been provided by Horizon Blue Cross Blue Shield of New Jersey, NJ Best, New Jersey's 529 College Savings Plan, the New Jersey Education Association, Community Food Bank of New Jersey, Guarini Institute for Government and Leadership at St. Peter's University, International Union of Operating Engineers, Local 825, and by the Fidelco Group. Promotional support provided by the New Jersey Business and Industry Association and by Tap Into TV.